It often starts with a moment of quiet alarm, a question you're almost afraid to ask yourself after a trip to the bathroom. Today, we're going to talk openly about that concern. My name is Dr. Sarah Collins. As a specialist who has dedicated my career to this field, I want to replace that worry with something far more powerful: knowledge. We are going to explore the critical differences between internal and external hemorrhoids. What are they? What do they mean for you? And what are the next steps? By the end of our time together, you'll have the clarity you need to take control of your health. First, let's demystify the word itself: hemorrhoids. The concept is quite simple. Imagine, inside your lower rectum and anus, there are small, pillow-like cushions of veins. These are perfectly normal. We all have them. They are a natural, functional part of our anatomy that helps with continence. Hemorrhoids, the condition, occur when these veins become swollen and inflamed. This is almost always caused by an increase in pressure. The most common culprit is straining during a bowel movement, often due to constipation. When you strain, you're performing a maneuver that dramatically increases pressure in the veins of your lower rectum, causing them to engorge with blood. Over time, this repeated pressure weakens the vessel walls and the supportive tissues, leading to the bulges we call hemorrhoids. Other causes include chronic diarrhea, pregnancy, and even just the long-term effects of gravity and aging, which can weaken the connective tissues that hold these vein cushions in place. In fact, this is incredibly common. For those of us over 50, about half will experience them. So if you're watching this, please hear me now. You are not alone. This is not a personal failing. It is a common medical condition. Now, for the crucial distinction: internal versus external. The difference is all about one thing: location. Inside our anal canal, there is an anatomical landmark called the dentate line. Think of it as a tiny internal border. Where a hemorrhoid forms in relation to this line determines everything. Hemorrhoids that form above this line, inside the rectum, are internal hemorrhoids. Hemorrhoids that form below this line, under the very sensitive skin around the anus, are external hemorrhoids. This location is the key because the types of nerves on either side of this line are completely different, which is why their symptoms are so distinct. Let's start with the one you often can't see or feel. Internal hemorrhoids are sneaky. Because they are located inside the rectum, an area with very few pain-sensing nerves, they are often completely painless. So how do they announce themselves? The most common sign is painless bright red bleeding. You have a bowel movement, look at the toilet paper, and see bright red blood. Or you might see drops in the toilet bowl. This is startling, but the blood is bright red simply because it's fresh blood from an irritated surface. Now, while they are painless, internal hemorrhoids can become more physically intrusive. We grade their severity. Grade 1. The hemorrhoid is swollen but remains safely inside. Bleeding may be the only sign. Grade 2. This is a prolapsing hemorrhoid. During a bowel movement, it might bulge out, but it retracts back inside on its own once you're done. You might feel a sense of incompleteness after a movement, only for it to resolve moments later. Grade 3. This hemorrhoid also prolapses, but it doesn't go back in by itself. You may have to gently push it back inside with your finger. This can be distressing, and this stage often marks a turning point where people seek medical advice due to the sheer inconvenience. Grade 4. In this stage, the hemorrhoid has prolapsed and now stays outside permanently. It cannot be pushed back in. This can lead to issues with hygiene, chronic moisture, and skin irritation, significantly impacting daily comfort. So, for internal hemorrhoids, think painless, bright red bleeding. Now let's cross that dentate line and talk about the one that makes its presence known much more aggressively. When people think of hemorrhoid pain, they are almost always thinking of an external hemorrhoid. Remember that dentate line? External hemorrhoids form below it, under skin that is packed with pain receptors. The classic symptoms are pain and aching, especially when sitting, intense itching and irritation, swelling and lumps that you can feel, and difficulty cleaning after a bowel movement, which can worsen the irritation. The main story here is discomfort. But there is a specific acute event that can happen: the thrombosed external hemorrhoid. Thrombosed just means a blood clot has formed inside. This causes a sudden onset of severe excruciating pain, A hard, tender, bluish lump appears very quickly. While the word clot is alarming, this is not the dangerous type that travels through your body. It's localized. The pain is intense because the clotted blood rapidly stretches that very sensitive skin. This is one of the most common reasons people seek urgent medical care for hemorrhoids. So we have two distinct stories: the internal hemorrhoid, the silent bleeder, and the external hemorrhoid, the painful lump. But here's a question my patients ask all the time. Doctor, can I have both? The answer is a definitive yes. It's very common to have both at the same time. This is where self-diagnosis becomes impossible and why seeing a professional is so important. This brings me to the single most important point of our conversation. While this information is meant to empower you, it is not a substitute for professional medical advice. Anytime you experience rectal bleeding, you must be evaluated by a healthcare professional. While often a sign of hemorrhoids, it can, in rarer cases, be a sign of other conditions. We do not gamble with health. A doctor can perform a simple examination to confirm the diagnosis and, more importantly, give you peace of mind. You should make an appointment if you experience bleeding for the first time, if your symptoms don't improve after a week of at-home care, or if you are in severe pain. For most cases, simple at-home measures provide fantastic relief. This is where you can truly take control. First, fiber and water are your best friends. When we say increase fiber, we mean aiming for 25 to 35 grams per day. Think of adding oatmeal for breakfast, a cup of beans or lentils to your lunch, and a side of broccoli with dinner. Soluble fiber, found in oats and apples, forms a gel that softens stool. Insoluble fiber in whole wheat breads and nuts adds bulk. You need both. And fiber is useless without water. It's the water that the fiber absorbs to do its job. Aim for at least 8 glasses a day. Second, fix your toileting habits. This is crucial. When you feel the urge to go, go. Don't hold it in. And please, leave your phone outside the bathroom. The toilet is not a library. The goal is to be in and out. Prolonged sitting, even without straining, places direct pressure on those veins. Third, use warm water therapy. A sitz bath is wonderfully soothing. Fill your bathtub with 3 to 4 inches of warm, not hot water, and sit for 15 minutes, 2 to 3 times a day, especially after a bowel movement. This relaxes the muscles, reduces inflammation, and improves blood flow, promoting healing. Finally, while over-the-counter wipes and creams can provide temporary relief from itching, they are a bandage, not a cure. Use them sparingly and avoid using any steroid creams for more than a week without a doctor's guidance. We've covered a lot today. We've taken a subject trapped in silence and brought it into the light. The core difference is simple. Internal hemorrhoids are typically painless bleeders. External hemorrhoids are painful lumps. And yes, you can have both. My hope is that you feel less worried and more informed. There is no shame, no embarrassment, only a path toward feeling better. Thank you for trusting me with your time. Your willingness to learn is the most important step toward taking control of your well-being. I'm Dr. Sarah Collins. If you found this helpful, please consider liking this video and subscribing for more compassionate medical guidance. Be well, be informed, and be kind to yourself. I'll see you in the next video.